Okay, I want to ask you something before we do anything else today. When was the last time you went to the dentist? Not because something was hurting, not because its tooth was broken, just to check, just to make sure everything in your mouth was okay. Because for most people watching right now, the honest answer is I cannot remember, or never, or only when I feel hurt or pain, maybe if it becomes unbearable. And I am not judging that at all, because dentists are expensive, the visits are uncomfortable, and most of us were taught that you only go to to the dentist when something is already wrong, not before. But not before. But today I want to completely change how you think about your mouth, because your mouth is not separate from your body. It is connected to your heart, your brain, your lungs, your blood sugar, your kidneys, and even your pregnancy. And what is happening in your mouth right now, the bacteria, the bleeding gums, the decay, could be doing things to the rest of your body that you have no idea about. And this is not a dentistry lecture. No, this is a whole body health conversation. And by the time we finish today, you're going to look at your toothbrush completely differently. Mm, Welcome, welcome, welcome. Happy Thursday, everyone. I am so glad you're here. I want you to drop a hello in the comments right now. Tell me where you're watching from. And I want to start with a very honest question. When was the last time you went to the dentist? Please type recently if it was in the last year, or type long ago if it has been be more than 2 years, or type never if you have genuinely never been to a dentist, to a dentist as an adult. I want to see where we are starting from today. My name is Loretta Ngwebe Sibiel, and this is the Safe Delivery Project. We are the Do Take Action family, and every Thursday at 3 p.m. we show up here and have conversations that actually change things. And so today we are going somewhere completely unexpected. Now I'm going to start by helping you understand what is actually, inside your mouth, because most people think of the mouth as just teeth and gums, but it's a whole world in there. The mouth contains approximately 700 different types of bacteria. 700, yeah, 700. And now, before you panic, most of them are harmless. Many of them are actually good. They help with digestion, they protect against harmful germs, and they keep the mouth balanced. But the mouth is supposed to have bacteria. The problem is not bacteria on their own. The problem is when the bad ones overgrow and start causing damage. And the main thing that causes that imbalance is sugar. When you eat sugar, the harmful bacteria in your mouth feed on it and protect acid as a byproduct. Now that acid attacks the outer layer of your teeth, the the enamel, and then slowly it dissolves it. And over time, holes from the tooth, and that is what we call tooth decay. And once that outer layer is gone, it does not grow back. Yeah, the decay goes deeper and deeper until it reaches the nerve, and that is when you start to feel pain. And then you see some people, they can't, you see them, they're not comfortable, they're complaining, oh, I can't eat, I can't chew, my teeth hurt, I'm in pain. And so that is exactly why we're having this topic, so that you understand everything about it. But like I said, tooth decay is not only part of the story, like I said earlier, but I want to tell you about something that is even more widespread and even more connected to your whole body health, and that is gum disease. Now, gum disease is an infection of the gums and the bone that holds your teeth in place. It starts as something called gingivitis. It's called Gingivitis, yes, it means your gums are inflamed and also infected. Now the signs are simple. Your gums are red or swollen. They bleed when you brush your teeth. And now here's something very important, because many people notice their gums bleed when they brush and they think nothing of it. They think it is normal. But bleeding gums are not normal. They are a sign that something is wrong. And so healthy gums do not bleed when you brush them. And then I used to remember some, you see some parents, they will say that if you brush your teeth very well, you see blood coming out, like, you know it means that you're actually brushing your teeth well. But no, 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 no. That person is wrong. That person is wrong. Rather, you're harming your gums. Okay, so if you're brushing and then you see gums coming out from your mouth, please don't feel because you're brushing well. No, you're actually harming you're harming yourself. And so if ging uh, if gingivitis is not treated, it gets worse. It becomes something called periodontitis sorry. And at this stage, the infection spread below the gum line and start destroying the bone that holds your teeth in place. So your teeth begin to loosen, and eventually, if nothing is done, the teeth fall out. But here is the part that changes everything. When your gums are infected, the bacteria do not stay in your mouth. They get into your bloodstream through the inflamed gum tissue. And then your blood goes everywhere to your heart, your brain, your lungs, your kidneys, and that is where the problem starts. This is the connection, and this is what today is all about. And so the World Health Organization says oral disease affects approximately 3.5 billion people worldwide. That makes them the most common non-communicable disease on the planet. And in Nigeria, where sugar consumption is rising and dental care is on underused, the burden is enormous. And so you get. And to my audience, I want to ask: have you ever noticed your gums bleeding when you brush? Please type yes or no in the comments, because most people think this is normal, and I want us to see how widespread this is. Now we're going to talk about the connection that I think will surprise most people the most, because the connection between your mouth and your heart. No, I'm talking about the connection now between your mouth and your heart. Now, people with gum disease have significantly higher rates of heart disease and stroke compared to people with healthy gums. This has been proven in multiple studies in multiple countries, and the connection is real even when researchers remove other risk factors like smoking and high blood pressure from the equation. How does it happen? The bacteria from infected gums can enter the bloodstream and travel to the heart. And once they get there, they can attach to the walls of the heart and the heart valves and cause a serious infection called infective endocarditis. And this is an infection of the inner lining of the heart. It is life-threatening. It requires long hospital stays and strong antibiotics. Sometimes it requires heart surgery, and one of its known causes is bacteria that came from an infected mouth. But beyond the direct bacterial invasion, the inflammation from gum disease also contributes to what happens inside the blood vessels. When your body is fighting a chronic infection like gum disease, it releases inflammatory chemicals into the blood. And so these chemicals travel through the body and it contributes to the buildup of fatty plugs inside the blood vessels. And these plugs narrow the vessels and makes it harder for blood to flow properly. That is one of the main causes of heart attacks and strokes. Now, scientists have actually found fragments of gum disease bacteria inside the blocked arteries of people who had heart attacks. Bacteria that started in the mouth and ended up in the arteries of the heart, and that is not a coincidence. This is a direct biological pathway. But the good news is that treating gum disease has been shown to improve cardiovascular markers in the body. And studies show that people who get their gum disease properly treated see reductions in their blood pressure and reductions in inflammatory markers in their blood. So taking care of your gums is literally taking care of your heart. And so research published in the British Medical Journal found that people with severe gum disease has a 24 to 35% higher risk of developing heart disease compared to people with healthy gums. So oral health is cardiovascular health. Now, before today, did you know that gum disease is linked to heart disease and stroke? Please type yes if you knew, or no if this is brand new information. Okay, so next I'm going to talk about the connection between your mouth and diabetes. This one is especially important for Nigeria audiences because diabetes is so widespread in our communities and so often poorly managed or undiagnosed. Now, the relationship between diabetes and oral health goes in both directions. You know, that diabetes makes gum disease worse, and gum disease makes diabetes worse. You know, they feed each other, but I'm going to explain both sides so that you understand my point well. First, diabetes affects the body ability to fight infection. High blood sugar weakens the white blood cells that fight bacteria. So if diabetic person has bacteria in their gums causing an infection, the body cannot fight it as effectively. And so the gum disease becomes more severe, like more quickly, and it is harder to treat. And also, high blood sugar, it makes the mouth a better environment for harmful bacteria because bacteria love sugar. Yeah, that bacteria love sugar. So diabetic people tend to have more harmful bacteria in their mouths, more severe gum disease, and more tooth decay, and more oral infections. And now here is the direction that most people never hear about. Gum disease, you know, gum disease makes it harder to control blood sugar. The chronic infection and inflammation from gum disease interfere with how the body responds to insulin. Now, insulin is a hormone that moves sugar from the blood into the cells. When gum disease causes inflammation in the body, insulin stops working as effectively, and this means blood sugar goes up and stays up. So, studies have shown that diabetic people who get proper treatment for their gum disease see real improvement in their blood sugar control, and the reduction is significant enough to be comparable to taking an additional diabetes medication just from treating the infection in the mouth. So if you have diabetes and your blood sugar has been difficult to control, you know, despite medication and dietary changes, nobody may have told you that untreated gum disease could be part of the reason why. So tell your dentist you have diabetes, and make oral health a deliberate part of your diabetes management. It is connected, and so it matters. And that's why studies estimated that treating gum disease in diabetic patients can reduce their average blood sugar measurement by an amount comparable to the effect of some sugar lowering medications. So oral health is metabolic health. Okay, um, let's talk about your mouth and pregnancy. Yeah, because you know, talking about something that is deeply important for anyone who is pregnant, you know, planning to become pregnant, or supporting someone who is. So, poor oral health during pregnancy, particularly untreated gum disease, is linked to premature birth, low birth weight, and pre-eclampsia. And this is almost never discussed in antenatal care in Nigeria. And yes, the evidence is very, very clear. And here is why. I'm going to mention why it happens because during pregnancy, hormones like estrogen and progesterone rise dramatically. Now, these hormones actually make the gums more sensitive and more reactive to the bacteria in the mouth. This is why pregnancy gene gingivitis is a real and recognized condition because many pregnant women experience increased gum swelling, redness, and bleeding even if their oral hygiene has not changed. Now, the hormonal changes may make the gums more vulnerable or inflammation. So, if gum disease is present during pregnancy, the bacteria from the infected gums enter the bloodstream. In a pregnant woman, that bloodstream is shared with the baby through the placenta. So, oral bacteria have been found in placenta tissue and in amniotic fluid. So, when these bacteria get there, they trigger an inflammatory response stimulates early labor. So the evidence from multiple studies is consistent. So pregnant women with moderate to severe gum disease have significantly higher rates of premature births, meaning delivering before 37 weeks. Babies born premature face enormous health challenges, and the link between gum disease and premature birth is now considered significant enough that health guidelines in many countries include oral health as part of prenatal care recommendations. And what should pregnant women do? Tell your dentist you're pregnant. Routine dental care, including cleanings and treatment of gum disease, is safe during pregnancy, particularly in the second trimester. In fact, treating gum disease during pregnancy is recommended because the risk of untreated infection to the pregnancy is greater than any risk from a routine dental visit. Brush twice a day with a fluoride toothpaste. Clean between your teeth daily. If morning sickness means you are vomiting regularly, wait 30 minutes after vomiting before brushing because the stomach acid softens the enamel temporarily. So instead, rinse with water first. Reduce sugar in your diet and include oral health as part of your antenatal care routine. It belongs there, it is not separate and it is part of taking care of you and your baby. So, a review published in the Journal of Clinical Periodontology found that pregnant women with gum disease were between 2 and 7 times more likely to have a premature low birth weight baby compared to women with healthy gums. So, oral health is maternal health. Now, to my audience, for anyone who has been pregnant, did any doctor, nurse, or midwife ever mention your oral health as part of your antenatal care? Please type yes or no. Okay, so now I'm going to tell you about two more connections that will genuinely surprise you. And that's the connection between your mouth and your brain, and the connection between your mouth and your lungs. Now, I'm going to start with the mouth and the brain. We have the Alzheimer's disease. The Alzheimer's disease is one of the most feared conditions in older life. The memory loss, the confusion, the gradual loss of the person you knew. And most people think of it as a brain disease that has nothing to do with the mouth. But recent research is saying something very different. A major study published in a leading science journal found the bacteria responsible for gum disease inside the brain tissue of people who had died with Alzheimer's disease. And the same bacteria causing the infection in the gums were found in the brain in animal studies. Infecting mice with this bacteria cause changes in the brain that look like Alzheimer's disease. And also, a large study in the United Kingdom following over 60,000 patients found that people with a diagnosis of gum disease has a 70% higher risk of developing Alzheimer's over a 10-year period compared to people without gum disease. Scientists believe the bacteria may travel from the mouth to the brain through the bloodstream or through the nerves that connect the mouth and the brain. And once in the brain, they trigger the inflammatory process that drive the kind of brain drainage seen in dementia. So the research is still developing, but the connection is strong enough to take it seriously. And so taking care of your gums throughout your life may be one of the things that protects your brain in your older years. And now I'm going to talk about the mouth and the lungs. The mouth is a gateway to the respiratory system, and every breath you take passes over the bacteria in your mouth on the way to your lungs. And bacteria from an unhealthy oral environment can be inhaled directly into the lungs. And so in healthy people this usually causes no problem. But in people who are elderly, hospitalized, or have weakened immune systems, other bacteria being inhaled into the lungs can cause a serious lung infection called aspiration pneumonia. Now, this is one of the most common and serious infections in hospitalized and elderly patients. And studies have shown that improving oral hygiene in these patients significantly reduces pneumo, um, as reduces pneumonia rates by up to 40% in some studies. So simply brushing more consistently and reducing the bacteria load in the mouth of vulnerable people has been shown to prevent pneumonia. You know, the mouth is protecting your lungs or harming them depending on how you take care of it. And so, study published in the European Respiratory Journal found that people with severe gum disease has a 77% higher risk of developing COPD, a serious chronic lung condition, compared to people with healthy gums. And so, your lungs are listening to what your mouth is doing. Now, let me address some things that are very specific to our context as Nigerians, because this conversation is not complete without talking about the things that shape our oral health practices every day. Do chewing sticks actually work? You hear people asking, does it work? Does chewing stick work? Now, this is one of the most common questions in oral health conversations in Nigeria and across Africa. And the honest answer is yes and no. Yeah, the honest answer is yes and no. Chewing stick, particularly those from trees like the neem tree and the arak tree, used widely in Islamic practice, have been studied significantly, and the findings show that they do have real antimicrobial properties. You know, the stick contain compounds that slow the growth of certain harmful bacteria in the mouth, and they also physically clean the tooth surface through the mechanical action of chewing. And the fibers at the tip of a properly frayed chewing stick do act as a basic brush against the tooth surface. So chewing sticks have genuine oral health benefits. They are not just traditions without substance. They contain active ingredients that really do fight bacteria, but they have limitations. A chewing stick cannot effectively clean between the teeth, and it is precisely in those spaces between teeth where bacteria accumulates most and where gum disease begins. And so a chewing stick also does not deliver fluoride, which is one of the most important protective ingredients for tooth enamel. Enamel, sorry. So my conclusion is this: a chewing stick is better than nothing. If it is an accessible option, it provides real benefits. But a fluoride toothbrush used twice daily combined with cleaning between the teeth provides stronger protection. So the best situation is when both are used together where possible. And then you see some other people asking, what sugar is doing to Nigerian children's teeth? Like, what does it do? I want to say this loudly and clearly. The oral health of Nigerian children is in a serious situation, and the main driver is sugar. Children are consuming more sugar than ever before through soft drinks, sweets, biscuits, sweets and candy, sugary porridges, sweet tea and Milo loaded with extra sugar, and fruit juice. And many of these children are not having their teeth brushed twice a day with fluoride toothpaste. You know, the combination is destroying developing teeth. And tooth decay in children is not just a cosmetic problem, it is a health problem. So decayed teeth cause pain that affect the child's ability to eat and sleep properly. The pain affects concentration and school performances. Severe tooth decay in children require dental work done under sedation. And decayed baby teeth can affect the development and positioning of the permanent teeth that come later. So sugar is to teeth what smoke is to drugs. Sugar is to teeth what smoke is to lungs. It is the primary cause of decay. Reducing sugar in a child diet is one of the most impactful things a parent can do for their child's health. So practical guidance for parents: start brushing as soon as the first tooth appears using a tiny amount of fluoride toothpaste. Avoid giving babies and toddlers sugary drinks in bottles, particularly at night. Limit sweeteners and soft drinks. Serve water as the main drink between meals. Take children for their first dental checkup by the time they are 1 year old or within 6 months of the first tooth appearing. So please, let's always pay attention to all these. I've seen some parents that they've never ever taken their children to dentists before simply because their child never complained of toothache, but it's not good. So please, when you're as soon as a baby start developing tooth, whether six or one, always go to a dental clinic for a checkup. Now, what about the fear of the dentist? Yeah, you see people saying that also. Now, dental fear is one of the most widespread fears in the world. And in Nigeria, where dental care is expensive, often hard to access, and frequently associated with pain, the fear is even more understandable. But avoiding the dentist creates a cycle that makes dental care more painful and more expensive over time. Because problems that are only dealt with when they are already severe require more invasive and more painful treatments that problems caught early. So a routine dental care, dental check and cleaning when nothing is wrong is one of the most uncomfortable, one of the least, yeah, the least uncomfortable health visits there is, and it is the extraction of a tooth that has been allowed to decay for years that is painful. So avoiding the check to avoid pain also guarantees more pain later. So try to find a dentist who communicates well and takes your concern seriously. Dental school clinics where final year dental students perform supervised treatments are significantly more affordable than private dental care while maintaining good quality. Now, let us get very practical. You have heard a lot of reasons why oral tooth matters. Now, let me give you the specific things to do about it. How to brush properly. I'm going to tell you how to brush your teeth properly, because you see some people, they'll go to the bathroom to brush, and within how many seconds they're done. You're done. And before you know, when they talk to you, just face one corner. So, because they don't brush properly. They don't brush properly. They just go to the bathroom, one, two, three, and they are done, which is not cool. So we are going to do a practical guidance on how to brush properly. Because most people, they brush their teeth incorrectly. They just they brush incorrectly, and even if you brush twice a day, doing it wrongly leaves significant bacteria and plaque behind. So I'm going to describe correct brushing in simple steps. One, you have to use a bristle toothbrush. Medium or hard bristles can damage the gum tissue and enamel over time, so soft is always the right choice. Use a fluoride toothpaste. Fluoride is the most important ingredient. It strengthens enamel and repairs the early stages of decay. Place the brush at a 45-degree angle to the gum line, and that is the area where your tooth meets your gum. So use small gentle circular motions, not harsh scrubbing. Many people brush too hard, and this causes the gum to pull back from the tooth over time. Brush every surface. The outer surface is facing the cheek, the inner surface is facing the tongue, and the three surfaces on top. And brush your tongue as well. The tongue holds large amounts of bacteria and is one of the main causes of bad breath. The people brush without brushing their tongue, and that causes bad breath. You talk and somebody cannot even, face you, and it's so embarrassing. So brush for 2 full minutes. Most people brush for less than 1 minute. 2 minutes makes a real difference to how thoroughly the teeth are clean. You can use a timer or count in your head. Brush twice a day, and once in the morning, once before bed. Before bed is the most important time because saliva flow reduces during sleep, and saliva is one of the main things that protects the teeth from bacterial attack. So going to sleep with unclean teeth gives bacteria the whole night to do damage. So after brushing, spit out the toothpaste, but do not rinse immediately with water. Rinsing washes away the fluoride before it has had time to protect the enamel. This feels strange at first, but it makes real difference to protection over time. Now, clean between your teeth. This is the step most people skip, and it is the most important step for gum health. The toothbrush cannot reach the spaces between your teeth, and these spaces are exactly where gum disease most commonly begins. You need to clean between your teeth once a day using floss or small interdental brushes. Now, this is not optional if you want healthy gums, but many people who brush twice a day and never clean between their teeth have significant gum disease in the spaces the brush cannot reach. So, the cleaning between the teeth is what prevents it. Now, if you find floss difficult to use, interdental brushes in the right side of your mouth will help you clean between the teeth. Now, bacteria produce acid that attacks the enamel for about 20 minutes. Someone who sips, no, someone who sips for for checkup, you don't have to wait till you feel hot. So it is always advisable, always go for a checkup regularly, at least once a year or twice a year. It's very, very important. Now, mm, we have been here for about let's say 40 minutes, and I want to say something before I let you go. You came here thinking, you came here today thinking the mouth was about seats and seats. No, you're living knowing the mouth is connected to your heart, your brain, your lungs, your blood sugar, your baby, and your immune system. You are living knowing that bacteria from your gums can travel through your blood to your heart valves. That gum disease and diabetes feed each other and make both worse. And that's a pregnant woman with gum disease is at higher risk of delivering too early. That gum disease bacteria have been found inside the brains of people with Alzheimer's disease. That oral bacteria inhaled into the lungs can cause serious pneumonia, and you are living knowing what to do. Brush properly twice a day with fluoride for 2 full minutes. Clean between your teeth, reduce sugar, and how often you have it. Drink water. Always drink water. Take your children to dentist early and go for your own checkup even when nothing is hurting. Because the mouth is not separate from the body. It never was. It is the gateway. And what happens at the gateway affects everything inside. So please brush your teeth. In fact, tonight, brush your teeth properly. Take 2 full minutes, clean between them, and think about everything the simple actions are protecting. Not just your smile, your heart, your brain, your lungs, and your blood sugar, even your future. So please, I want you to like this video. If today genuinely surprised you, leave a comment telling me the one thing that shocked you the most. Was it the heart connection, the pregnancy connection, the brain connection, or the diabetes connection? I want to know which one hits you hardest. Subscribe so you never miss a Thursday, and please share this because somewhere in your contact is a pregnant woman who has never been told about gum disease and her baby. A diabetic person who has never been told their blood sugar might improve if they treat their gum disease. A parent who has no idea what sugar is doing to their child's teeth and through those teeth to their child's whole body. Your share would reach that person today. I'll see you next Thursday. Take care of yourself, and tonight, please, 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 please brush your teeth properly. Thank you, and do have Lovely. Okay.